Okay, so that was what I was gonna ask. What is the difference
Yeah.
between when you say brain fog and then feeling
Mhm.
like you're forgetting everything? Because I forget everything, and then I can't remember if I, said something or I just thought it. Do you know what I'm saying?
Yes.
So, I always am like, "Oh my god, am I about to get Alzheimer's or, like, what's happening?"
That is it's so classic and something I hear again. I actually was in the line at Aldi getting
Mhm.
and checking out, and the lady in front of me had left something behind. And was like, "Will you mind watching my cart because I came here especially to get salmon and I did not get the salmon." And I said, "Listen, I totally get it. I will hold your place because it is that brain fog. It does get better, but
Mm,
it impacts not only impacts us in our insecurity about being able to function in our jobs, but it really can impact your confidence, your ability to be your executive functioning if you are trying to run a corporation or run your kids to their dentist appointment. You have to be able to function in the way that you were able to 2
before.
years ago.
Yeah, and it creates a sense of worry because you're kind of like,
Mhm,
"Oh my god, can I get through this without other people noticing
mhm.
this, that I'm going through this?" So are these symptoms that you're talking about things that are happening in perimenopause, and then after you go through this 12 months of not getting your period and you've actually hit the day of menopause, do the symptoms start to, go away and you start to feel more like yourself? Or explain the arc of that.
Sure. Yeah, absolutely. So certainly in perimenopause, the when those hormone levels really start swinging. So
Mhm.
because what happens is that your ovaries have a little bit more difficulty recruiting a follicle to ovulate. And so your brain sends a message called follicle stimulating hormone to the ovary when the estrogen level is low. And if your ovary doesn't respond right away, it sends a whole lot more. And it's like, oh no, really, I really mean, I really want estrogen. And so your ovary, once it does start recruiting these lazy follicles that are now been sitting in the ovary for a long time, and they bring up all those cells, like I said, around it that produce the estrogen, and you get all of this estrogen much higher than you were getting in your 20s and 30s. Sometimes, a normal estrogen level could be 100, 150. You're getting 300, 400, sometimes even 600. And I'll have patients who have their primary care doctor was like, let me just check your hormones. And they check it and they freak out. They're like, she's got a tumor. And I'm like, no, if you check it now, a week later, it's going to be way down here. And
Mm,
that change from an estrogen level way up here to an estrogen level way down here, back to your normal baseline, that difference is what you're feeling. Instead of an estrogen pattern that goes like this, you have an estrogen pattern that goes like that. And that is where your brain and your joints and your mood are feeling that loss of estrogen in that second half of your cycle.
mm.
It's almost like anyone who got mood changes during that premenstrual, like PMDD is premenstrual dysphoric disorder. It's like that, but on steroids
Mm,
because the changes are so much wider.
right,
And it lasts through perimenopause, and then your ovaries are still making estrogen after that 12-month marker, but they're just not ovulating and getting enough change to have enough lining tissue to shed. But
right.
they're still going up and down for several years after that. And eventually they'll get to the point where they're not really making much of anything. And you do see actual hormone changes in the structure of the brain when they do brain MRI. You see restructuring of the brain. And most people, as they come through it, some of that brain fog and some of the word finding and those feelings of memory loss will get better, but not everyone.
Right.
So some people, so I'm sorry, but
No, no.
oh no, so when we look at the replacing estrogen, it actually, the studies will show that if we start replacing that estrogen at the time in our 40s and 50s, we can actually prevent some of those changes from progressing to dementia.
Got it. Okay, so let's talk about the hormones and that you're
Mhm.
bringing up. Explain if okay, so a lot of people that I've spoken to have said that for
Mhm.
them, that they thought hormone replacement therapy was somewhat dangerous and
Mhm.
there was some risks to it. So can you talk about the risk and also talk about the risk and benefits of bioidentical hormones, which I don't know what that is.
Sure.
Okay.
Let's see where we can start the best. The best thing I think would be, let's just talk about what the term bioidentical means, because I think that that's a really good place to question that a lot of people have.
Okay.
Bioidentical just means that it is the chemically identical to the structure of the estrogen and progesterone that your body makes from your ovaries.
Okay.
So it's actually a marketing term. It's not really a medical term, but it's useful in its description of what you're getting. So
Okay.
you can make
And
estrogen.
is it made just for you personally based on what you're used to, or it's
No, I think that that's really what's interesting. I think what people confuse compounded hormones with bioidentical hormones.
okay?
Compounded hormones are taking the hormones that this particular type of hormone, the estradiol is what your body makes from your ovaries, and progesterone that are chemically the same, and then they just mix them into a compound that is of different strengths. So
Mhm.
when you have compounded medicines versus medicines that are FDA approved from your CVS, for example,
Mhm.
the difference is that the compounding pharmacist, is taking the same medications that he's taking, or she is taking them from a jar and mixing it with a vehicle like a lotion or a gel, and figuring out what level you want and what concentration. It's definitely not any safer than any type of any kind of hormones that you're getting commercially, but it is actually less standardized. So there used to be a lot of what you would get from the CVS or Walgreens were prescribed by doctors, were things that were not bioidentical, but were estrogens, or there's estrogens and progestogens, which is the
Mhm.
progesterone. So when you get a birth control pill, it has an estrogen and a progesterone in it. But they are typically not bioidentical. They are chemically made to be actually more intense than the what you would get that's bioidentical. So, and that's a good thing for birth control pills, because they help suppress ovulation better than menopausal hormonal therapy. So they are not made from they're not exactly the same as what your body would make, uh,
Okay.
and so that's the difference between bioidentical and the FDA approved things that are synthetic hormones.
Okay.
Is
So
they just have a different concentration.
and why would people say that they're very risky to take when it sounds to me like it would be great for you because it would make you feel better?
Yeah. So the one of the reasons is because we had is there was a lot of misinformation that came out from a study in 2002 called the Women's Health Initiative, and it was supposed to be a great study, but it unfortunately studied hormone replacement therapy using conjugated equine estrogen, which is estrogen made from horse urine, harvested from horse urine, and a synthetic progestin um, called medroxyprogesterone acetate. And the study was done to try to look at how to prove that hormone replacement therapy is awesome for cardiac disease prevention. They thought because women up to the age of 40 have much lower heart disease risk than men. And then once they get to 60, their heart disease risk is equal to men. And it ends up being the number one killer of women is heart disease. So
Oh,
they said, we're going to do this study and prove how amazing it is for people to be on hormone therapy. The only problem was that they didn't study the right women and they didn't study the right hormones. When you looked at the group that they studied, it was women, the average age was of the women they started on hormones was 62.
Oh,
So they already had a lot of cardiac plaques built up in their vessels. And so then once they started them on hormone, this estrogen, the conjugated equine horse urine estrogen, it was very inflammatory and caused those plaques to break off and clot off and give them heart attacks. So they stopped the study, but there was not all bad from this study because there are some good things that they found. They found that actually that women on estrogen alone had a decreased risk of breast cancer instead of an increased risk. But unfortunately, what they saw and what was all over Newsweek and all the morning talk shows was, tell your mom she has to stop her hormones because it's going to kill her.
Right.
And then we didn't get a lot more from that. And that's what we grew up with.
Right.